Depression is one of the most common mental disorders in the world. In Malaysia alone, close to 500,000 people suffer from depression. But because it's a mental illness, it is a lot harder to understand than physical illnesses such as diabetes. It comes with a lot of stigma, where people brush it off as simple sadness, being lazy, or unmotivated. However, clinical depression is a real medical disorder. It doesn't just go away, and it lingers for at least 2 consecutive weeks. It severely interferes with one's daily life and their ability to function. Depression doesn't always need a reason to exist. There is no one reason or factor that causes depression. It can happen for a number of reasons and at any time from childhood through old age. It could develop from life events such as someone's death or in other cases from stress. There's also the case of it being due to genetics and chemical imbalances in the brain as well. These factors can overlap and there's usually more than one cause. Depression can have many different symptoms, ranging from a low mood, loss of interest in things you'd normally enjoy, changes in appetite, sleeping too much or too little, poor concentration, loss of energy, or even recurrent thoughts of suicide. If you have at least 5 of these symptoms, then you qualify for a diagnosis of depression. The good news is that depression is treatable through a variety of different methods, and it's different for each person. There's regular therapy sessions with licensed professionals, and some may even take medications to help regulate their brain chemicals. If you know someone struggling with depression, gently encourage them to seek help. If you suspect yourself of suffering from depression, it's best to get properly diagnosed and seek out help too. If you feel guilty or ashamed, don't be. It should be pointed out that depression is a medical condition just like asthma or diabetes. It is not a weakness or personality trait. Depression is very real and can get overwhelming, but you shouldn't have to face it alone. Do not be afraid to ask for help, nor let the stigmas deter you, no matter how bad it gets. Even just talking about depression can help. Open conversations about mental illness help erode stigma and make it easier for people to ask help. Also remember that help is always available through the suicide helpline that is available 24/7, or even finding local therapists and licensed mental health professionals in your area. Remember, you are not alone and help is always available. There is always hope that things will get better.